Good morning. This is a special coverage of the coronavirus crisis using the combined forces of TV5 and Signal TV's One News, Radyo 5 and 1PH. Simulan po natin ang balitaan sa nakatakdang total closure ng lahat ng border sa Davao Region bukas. At para magbigay ng karagdagang detalye, makakausap natin si News 5 correspondent Jem Abansenya na naroon mismo ngayon sa Tagum City, Davao del Norte. Jem, ano yung parameters nitong closure na ito?
Yes, Bok, no. Simula nga ng 12:01 ng madaling araw ng March 19 ay isasarado ang lahat ng entry points ng Davao Region. Yan ay napag-usapan kahapon sa Regional Peace and Order Council ng Davao Region at chairman nga dyan si Davao City Mayor Sara Duterte. At isa nga dun sa kanyang proposal na talagang isuspende ang lahat ng air, sea and travel land travel papasok ng Davao Region. Bok?
Okay. Bok, clarify ko lang kasi nabanggit mo yung closure ng entry ng mga tao sa Davao Region. What about exit? Or is it both ways isasara?
Nilinaw yan na Bok ni Davao City Mayor Sara Duterte sa isang interview na pwedeng lumabas. Yun nga lang Bok, within 14 days ay hindi na ulit makakapasok. So totally sarado ang entry points although pwede pang lumabas kung sino man yung gustong lumabas ng Davao Region. Bok?
Okay. So it's a lockdown of the Davao Region itself. Wala nang pwedeng pumasok, pwede ka lumabas, pero pag lumabas ka, 2 linggo ka na hindi makakabalik.
Yes, Bok.
Okay. Jem, I assume na the reason for this is dahil umiiwas yung Davao Region na may makapasok na merong coronavirus disease. Although may isang nasa Davao Regional Medical Center ata na nag-positive, di ba?
Yes, Bok, and recovering na nga raw yung status nitong first positive case ng COVID-19 dito sa Davao Region. Yun nga lang, Bok, dito meron kasi tayong mga PUI and sa talangan ng Department of Health ay 61 na itong mga persons under investigation. Although yung 31, the discharge na, pero merong 2, Bok, na namatay dito sa PUI and for confirmation pa, hinihintay pa ng DOH Region 11 yung resulta mo sa RITM kung positive nga ba sa COVID-19 itong 2 namatay sa PUI. Bok?
Okay. Jem, teka, klarin ko rin yung entry, yung control dun sa entry sa Davao Region, is that complete, total, or merong exemptions?
Yes, Bok. Merong guidelines na inilabas nga itong Davao Region COVID-19 Task Force na merong mga exemptions. Yun nga lang very strict talaga. Kasi for example, merong mga cargo vehicles na kailangang ipasok, may mga supply na kailangang ipasok sa Davao Region. Kailangan nilang ilipat yung mga kanilang karga, maging kung maaari ay yung mga driver ay hindi na rin papapasukin pag nakaraan na dito sa boundary nga ng Davao Region. So ganun sila ka-stricto ngayon sa kanilang ipatutupad na lockdown. Simula yan ngayong madaling araw na March 19. Po.
Naku, medyo madugo yan kung maraming karga at kung mabigat yung karga. Ibig sabihin, yung sasakyan mismo at yung driver hindi papapasukin, yung kargamento lamang ang ililipat doon sa ibang sasakyan na magmi-meet sa kanila doon sa border.
Yes, Bok, yun yung base sa guidelines na inilabas. Isa yun yung sa mga proposal. Pero sa ngayon ay inaayos pa nila yung mga karagdagang guidelines, especially dito sa mga exemptions upang hindi nga talagang, alam mo yun, hindi ganun laki yung negatibong epekto nitong ipapatupad na region-wide lockdown ng Davao Region.
Okay. Jem, paano naman yung, kasi that's as far as cargo is concerned pero what about people? Kasi Davao Region is a pretty well-developed region So with that, you can assume na marami mga migrant workers from the surrounding provinces who commute possibly every day or every week to and from Davao City. Walang exemption sa kanila? Or meron din?
Bok, walang exemptions na kaya nga advice, inaabisuhan na ng Davao Region LGU na kung merong mga Davao residents na kailangan bumalik na dito ay kung maaari ay umuwi na within this day para hindi na maabutan ng lockdown. And kung merong lalabas, wala namang problema sa lalabas. Yun nga lang talaga doon sa mga papasok. Kung kailangan nila, meron nga rin sa isang interview nga, sabi nga ni Mayor Sara, kung merong mga taga-labas ng Davao Region na kailangan nilang magpagamot sa Southern Philippines Medical Center o sa kahit anong ospital dito sa Davao, ay kailangan pumasok na sila ngayong araw upang hindi nga maabutan nitong lockdown dahil stricto talagang ipapatupad itong region-wide lockdown and 14 days to book. So ibig sabihin kapag lumabas ka, 2 linggo ka nga talagang hindi makakabalik na Davao Region.
Okay, Jem, that's as far as travel through the border is concerned. What about movement and activity within the Davao region? You're looking at several provinces dun sa Davao region. For example, would people be able to travel from in between Davao City to Davao Oriental or vice versa or Davao Oro and so on down the line?
Boksa kayo, actually nandito tayo sa boundary ng Davao del Norte at Davao City. Stricto pa rin talagang natutupad itong partial lockdown. Pero pagtungtong ng 12:01 ng March 19 ay ililift na, i-dismantle na itong mga roadblock in between sa cities and municipalities within Davao region.
Okay. So internally doon sa rehiyon, maaring lumabas-pasok yung mga tao doon sa mga syudad at mga munisipyo. Doon lamang sa rehiyon mismo, yun ang may boundary na.
Yes, Bo, kasi katulad nga ngayon, actually ang Tagum City, Bo, hindi pa rin talaga pwedeng lumabas ang kahit sino man o any private and public vehicles from Tagum City. Pero mamaya nga ay ililift na ito. And nilinaw rin ng mga lokal na opisyal ng Davao Region na yung public transportation ay as is pa rin within Davao Region nga lang, Bo. And wala pa rin suspension ng public transportation kaya hindi pa ganun kalaki yung epekto within Davao City and dito nga sa mga katabing probinsya ng Davao City.
Okay, Jem, kamusta naman yung mga establishments diyan sa rehiyon na 'yan? Meron bang lockdown doon sa commercial activity doon sa rehiyon o tuloy-tuloy lamang?
So far, Bok, wala pa namang order na ipasarado itong mga business establishments within Davao Region. Yun nga lang, kapansin-pansin talaga, Bok, sa pag-iikot natin from Davao City nga ay marami nang nagsarado munang mga temporary close na mga tindahan, ng mga business establishment katulad nga ng mga salon and spa. And inabisuhan na rin ni Davao City Mayor Sara Duterte Carpio itong mga private companies na maghanda sila ng flexible work plan para nga hindi masyadong mahirapan itong kanilang mga trabahante.
So, Jem, yung sinasabi mong yan, that is only purely voluntary closures. Wala pang mandatory closures ng mga establishments, for example, retail and so on down the line. Hindi kagaya ng nasa Metro Manila ngayon at Luzon.
Yes, Bok. As is pa rin yung ibang mga business establishments dahil nga so far wala pang order na inilalabas yung Davao LGU.
Okay, Jem, last question. Kamusta yung supply ninyo dyan ng protective gear, medical equipment, pagkain at tubig? Okay ba tayo dyan?
Bok, doon nga tayo medyo nagkakaproblema sa mga protective gear and sa mga medical equipment dahil mismo yung LGU ay kinakapos sa mga face masks, maging sa mga alcohol. Although, pagdating naman sa supply ng tubig at pagkain ay wala pang problema. Although, merong ilan na mga taga Davao, Bok, no, na nagpa-panic buying and dinidiscourage ito ng mga lokal na opisyal dahil nga ayon nga kay Mayor Sara ay baka masayang lang itong mga hinoard na pagkain at hindi naman daw ito assurance na magiging ligtas sa COVID-19.
Okay, maraming salamat. Gemma Bansenya reporting live from Davao. The Energy Department has ordered an expanded price freeze on key fuel commodities such as liquefied petroleum gas or LPG and kerosene. The order now covers the entire Philippines after the President declared a state of calamity throughout the country. The price freeze applies starting today and will last until March 31. Remember that the DOE initially declared a price freeze on fuel products in Metro Manila, Cebu City, Negros Oriental, and Iligan City. That now covers the entire country. Although price freezes are strictly prohibited, oil price rollbacks can and should still be implemented. At makakausap naman natin po ngayon si Navotas City Mayor Toby Tiangco na nasa kabilang linya. Magandang umaga po, Mayor Tiangco.
Yes, magandang umaga, Ed.
Ay sir, sir, konti munang assessment doon sa inyong area. How is the volume of people and the movement and activity of people in your city?
Siyempre, minimize na kasi kahit bago yung announcement no Monday ba yun o Tuesday,
Apo.
di ba po ang Metro Manila mayors is nagpasa kami ng mga ordinansa ng curfew no
Apo.
nung linggo. So noong Lunes, pinatupad na namin yung mga curfew. So,
significant po.
talagang limited, no? Doon yun sa mga hindi authorized. Kaya lang, alam nyo, dito sa Navotas na andito yung pinakamalaking fish port, di ba? That
Oo nga po.
supplies
Opo.
fish to the entire Luzon.
Opo.
So hindi naman namin pwedeng isara yun kasi tataas bigla ang presyo ng bilihin. Wala nang trabaho yung tao, tataas pa yung presyo ng bilihin. So to stabilize the price, nagkausap kami ni General Manager Glenn Pangapalan ng Navotas Fish Port. May strict protocols naman sila katulad ng pagkuha ng temperature, dapat naka-white boots, dapat naka-face mask, dapat naka-white shirt. At lahat ng mga goods na manggagaling dito dahil perishable to ay bibigyan na ng sticker para hindi na matagalan yung pagdi-deliver. Dahil alam niyo naman ang isda ay sariwa, naka-yellow lang yan. No?
Opo.
So
Opo.
hindi ko pwedeng ma-delay yan.
Opo.
So yan yung mga bagay na pinagtutuunan namin ng pansin.
Opo.
And
Sige po.
pagkatapos ng executive order ng presidente, kasi noong sa ordinansa namin, hindi naman namin masara yung mga computer shops, yung mga bilyaran, kasi may valid business permit yan, di ba? Unless mag-violate sila twice, saka lang namin sila masasara. Ang kagandahan ng executive order ng presidente, maliwanag kung ano lang yung mga pwede. At hindi ba pwede talaga yung computer shop, bilyaran, kung ano pang pinaglilibangan ng tao. So pinasara namin yan. Hindi naman dahil ayaw natin sila maglibang, kung hindi talagang kailangan patupad yung social distancing.
Opo, opo. Well, I was going to that kanina. The fact is that yung major product ng Navotas yung mga isda which are perishable items. So pag dumating sa mga border areas kung sa may mga checkpoint, sa inyo pong obserbasyon, hindi naman sila naantala. I know you just said kanina na may arrangement na kayo of some sort of sticker system, but how is it being implemented and how's it going as far as yung free flow?
Siyempre, nung unang araw, nagkakalituhan, di ba? Normal naman yun kasi no one has prepared
Opo.
for this. No, lahat tayo nakahanda doon sa Lindol, sa Bagyo, wala naman nakapaghanda dito. Inaamin naman natin yan, no? So, pero doon sa nakikita ko Viber group namin, wala nang reklamo as of this morning. Hindi katulad yesterday morning, may mga nagbibiyahe ng isda na nahirapan.
Opo.
Pero kanina umaga, wala na ako nakitang problemang ganon.
Tapos po, well, yung handling po ng isda, that's a very, well, I wouldn't say very personal thing, pero di ba, hawak-hawak yan ng mga trabahador eh. It's not exactly a mechanized system eh. So we suppose that the systems have been put in place to make sure that sanitation is very well taken care of.
Yes, dapat mag-alcohol sila, dapat naka-face mask, dapat kinukunan ng temperature. Kaya maganda kasi dun sa galunggong-like species, hindi naman siya pareho ng ibang species na pwede mong, di ba may mga isda na mas masarap kung hindi masyadong, kung half-cook, kung medium rare, di ba may mga isdang gano'n, di ba?
Opo.
Yung galunggong naman talaga pinipiliso natin yan hanggang dun sa buto. Mas masarap nga siya kung mas todo pirito mo, mas masarap siya, di ba?
Oh, hindi pwede sa simi.
Lutuin lang na mabuti. Iba nga, katulad ko, pinapaksiw ko muna bago ko ipirito para masarap. So, lutuin lang natin ng mabuti.
Mayor, kamusta po yung enforcement niyo ng curfew? Ano rin kayo, di ba? 8 to 5, 8 p.m. to 5 a.m.?
Yes. Stricto lahat ng barangay natin. At kanina po, nagbigay ho ako sa kanila ng instruction na kung meron talagang makulit, dali na nila sa police at i-invoke yung Article 151 ng Revised Penal Code.
Mayor, earlier kasi, well, not in Navotas, but earlier there were a lot of concerns na yung mga kababayan nating medyo mahirap at hindi nakapag-stock up ng pagkain at basic necessities ay mahihirapang lumarga para bumili ng pagkain and so on down the line with the quarantine. How is it going as far as yung LGU helping out people who do not have the resources and the facility to get their basic essentials?
Okay, alam nyo, kahapon po, nagdeklara tayo ng state of calamity
Opo.
sa Navotas.
Opo.
Kahit wala tayo positibong COVID-19 case. Kaya natin nagawa to is because of the executive order of the President. Kaya talaga napakaganda yung executive order niya. So ngayon, nag-emergency procurement na kami ng goods at mamimigay ho yung local DSWD ng mga
Food packs.
items sa mga tao, no?
Opo.
Of course, yung challenge dito is, I hope mas maintindihan ng ating mga kababayan is, ang challenge dito is hindi to pareho ng iba na pwede kami tumawag ng madaming volunteer na
Opo.
magtulong mag-pack. Kasi,
Opo, that's something you'd like to
diba,
avoid.
social distancing nga. So talagang ako'y nagpapasalamat sa mga empleyado ng munisipyo, though limited sila, nagsimula na sila kagabi ng mga stockpile namin na pinapack nila. The next challenge will be, hindi naman po pwede papuntahin sa City Hall yung mga tao.
Nako, magulo po yun.
Pumila. So ang gagawin namin dito, as of now, ang naiisip namin, the only way to do it following the protocols of social distancing is ibabahay-bahay ng mga social worker namin, which is not easy, diba?
Opo.
So, susubukan namin ang aming makakaya para magawa ito sa lalong pinakamabilis na panahon. Kaya lang hindi ho talaga madali kasi hindi ito pareho nung iba kanya nasunugan, pinapapila yung tao. Ang bilis namin mag-distribute nun eh. Dito hindi naman pwedeng papilahin tao, hindi naman po pwedeng papuntahin. So pagtsatsagaan talaga itong bahay-bahay, no? At ako'y nakikiusap. Alam naman natin yung poorest of the poor. Yung poorest of the poor, yan yung mga nakatira sa tabing ilog, tabing dagat, doon sa mga housing natin, yung mga informal sector. Sila po yung uunahin namin. So ako'y nakikiusap. Alam ko lahat ng tao apektado. Kaya lang yung pinakamahirap, yun talaga ang uunahin natin.
Ayun po yung challenge dyan eh. You are looking at a massive logistical operation but at the same time want to minimize personal contact. So medyo conflicting yung dalawa. Medyo mahirap gawin.
Hindi, but siyempre, ang pinaka-importante lagi is yung social distancing, no? Alam kong araw-araw kailangan kumain yung tao. Kaya lang, alam niyo, pag nagkakawaan, mas malaking problema ang haharapin natin dito, no? So, ako'y nakikiusap, no? At siyempre, madami akong natatanggap na messages. Patulad yung mga tricycle driver, nung una, nakikiusap sila kung pwede silang pumasada. Pinakiusap naman natin, but it was not approved. And I understand, and we will always follow kasi mas alam ng interagency task forces. So ako'y nakikiusap doon sa mga tricycle driver, sa mga pedicab driver. Sana intindihin nyo, pero kami ho'y magpapadala ng food pack. Babahay-bahayin na namin yan.
Okay. Maraming salamat po, Mayor Toby Tiangco.
Tapos pwede mag-update lang ako para lang hindi kinakabahan yung ating mga kababayan. No? Yung latest update na nakuha ko from our City Health Office is 4 a.m. of today, March 18. No? Meron ho tayong 67 na PUM. Yan po yung persons under monitoring. Ibig sabihin na exposed sila sa taong may COVID-19 na positibo or galing sa lugar na may COVID-19. Pero wala pong sintomas. 67 po yan sa
Mayor,
Nabota.
67 or 57?
67.
67.
Sa 6-7, kasama na ho kami dyan ni Congressman John Tiangco dahil PUM din po kami dahil na-expose kami sa isang official event. Tapos yung PUI natin is dalawa, yung persons under investigation. Ito po yung may sintomas. Pero hindi ho sila positibo. No? So, ang minomonitor natin is 69. At syempre, sa awa ng Diyos, wala pong positibong COVID-19 case sa Navota. So napakahalaga, social distancing, quarantine, at syempre magdasal.
Pero Mayor, yung mga PUM kagaya po ninyo, ano po yung protocol dyan? Are you confined to barracks, to the house? How does that work?
Self-quarantine, hindi lang confined to the house, confined to a room. Kasi hindi mo alam di ba? Pwedeng asymptomatic ka, no? Kaya lang, hindi kami nagpapatest kasi ang protocol ng DOH is yung may symptomas lang ang magpatest para hindi naman
Hindi maubos yung test kits.
Para ma-maximize yung test kits natin. No? So hindi kami nagpapatest. So pag natapos yung quarantine period namin, tsaka pa lang kami lalabas. But wag po kayong mag-alala. Nakamonitor ho ako sa ating mga kasama sa City Hall. Meron kaming Viber group, ang daming Viber group. So nakukuha ko lahat ng feedback, nakakapagbigay tayo ng instructions kahit tayo ho ay naka-self-quarantine. Kasi kahit wala naman akong simptomas, pag lumabas ako, di natin alam, baka may mahinang katawan dyan, hahawak na tayo. Tsaka ang pinaka-importante is, kahit mayor tayo, susunod tayo kung anong sinabi ng DOH.
Opo. Maraming salamat po, Mayor Toby Chanco, and good luck po. And we wish you, we wish you the best of health. We turn you over now to the government's briefing on how they are responding to the COVID-19 pandemic.
Involved in the production, processing, and distribution of basic necessities such as food sa mga supermarkets, groceries, convenience stores at wet markets, pharmacies and drugstores, and banks or remittance centers. Sino pa ang pwedeng? PNP, AFP, and other uniformed personnel. Personnel involved in health work, border control, emergency, and other mission-critical services. Media, with the authorization from PCOO. Paalala lang po, always bring and present the following at designated checkpoints: identification card, proof of residence, certificate of employment, delivery receipt for those transporting goods to and from the quarantine area, and authorizations or certifications. Don'ts. Those who are at high risk of infection should not go out. Sino-sino po ang mga ito? Seniors, 60 years old and above. Those with pre-existing medical condition like cardiovascular disease, hypertension, diabetes, COPD, cancer, and others. At lalong-lalo na po, pregnant women. Do not ask non-exempted individuals to accompany you to your workplace. Do not loiter. Do not intimidate or resist persons in authority. Always remain calm and respectful. What other establishments are open? Do's. All basic utilities should continue to operate. Water, electricity, internet, telecommunications. Other critical services should remain open. Garbage collection, funeral, and interment services, gasoline stations. Capital markets to open today, March 18. And business process outsourcing, BPO, IT, and export-oriented establishments as long as they are provided temporary housing, shelter by their companies. Don'ts. Casinos, gambling places, including pogos, closed po yan. Hotels, closed din po. Hotels shall not accept any new bookings. Regarding mass public transportation, dues, LGUs and employers should provide point-to-point transportation for people authorized to report for work, specifically health workers. Transportation from the airport may be provided by the DOTR or OWA para sa ating mga kababayan OFWs. Walking or biking is allowed. Don'ts. All public transportation are not allowed to operate, such as tricycles, pedicabs, taxis, Grab, jeepneys, buses, including MRT and LRT. Para naman sa flow of goods, dues, movement of cargo via air, land, and sea shall be unhampered. Don'ts. Cargo trucks and vans should not be blocked from entering the ports, expressways, or highways. Para sa mga empleyado sa pribadong sektor, do's. Employers are encouraged to adopt a work arrangement that will not require physically reporting for work. Employers should extend financial help or assistance to their employees, may grant prorated 13th month pay. DOLE and DSWD will provide social amelioration packages for those affected by the work stoppage. Don'ts. Unless the company is engaged in basic necessities or services, employers should not require their employees to report for work. Employers should not terminate their employees by reason only of not reporting for work because of the COVID-19 situation. Para naman sa mga empleyado na nasa government sector, do's. Employees in the executive branch should work from home, except those rendering emergency frontline services. Those authorized to work should maintain only a skeletal force. Don'ts. No travels, no events, no trainings will be allowed. Para naman sa travel in and out of the Philippines, do's. Filipinos abroad can return to the Philippines anytime, including their foreign spouse and children. Other permanent residents of the Philippines may also return. All returning Filipinos and permanent residents from China, Hong Kong, and Macau shall be subjected to a 14-day quarantine in a quarantine facility. All other returning Filipinos and permanent residents arriving in Luzon shall comply with mandatory home quarantine. Don'ts. Filipinos who will go out as tourists to any destination shall not be allowed to leave the country. Don'ts. No send-off party will be allowed to accompany departing passengers. And last na lang po sa do's, OFWs, balikbayans, and foreign nationals will be allowed to leave the Philippines at any time as long as their departure is 24 hours from the time they leave their homes or hotels. Mga kababayan, kung magkanya-kanya po tayo, di tayo magtatagumpay. Ika nga ni Pangulong Duterte, together we can beat COVID-19. Together we heal as one. Maraming salamat po.
Secretary, meron kaagad pong nagtanong dahil sa binasa ninyo. Meron daw po kasi mga private companies na may policy daw po na ipinalabas na hindi daw po i-charge yung kanilang pag-stay home sa mga leave. Parang i-consider daw po silang absent. Mihingi po sila ng guidance sa tulong sa government.
Opo, kung may ganyan pong mga reklamo, paki-relay na lang po sa Department of Labor and Employment. Kagabi po, nakasama ko po si Secretary Bello sa mga announcements na binigay po namin kagabi. At bukas po ang tanggapan ng DOLE para tanggapin po ang mga reklamo ng ating mga empleyado. Palagay ko naman po sa ngayon, no, not to defend anybody, but sa ngayon, syempre, lahat po tayo ay both employers and employees ay nag-adjust po sa sitwasyon ngayon. So, clarifications lamang po siguro ang kinakailangan natin gawin, maging sa empleyado, maging sa mga employers po natin. So, bukas po ang tanggapan ng DOLE para magbigay po ng mga clarifications para po sa inyo.
Yun daw pong online classes kung isususpend din ng...
Ay, hindi po. Online is fine. Wala namang problema sa online.
Salamat, Secretary. Samantala, silipin na rin natin ang mga kaganapan ngayon sa Davao kasama si Jay Lagan. Jay?
Magandang umaga.
Senate President Tito Sotto is asking the Finance Department to extend the April 15 deadline on the filing of income tax returns. Businesses have been clamoring for an extension after the coronavirus infection disrupted operations. In a report by the Philippine Star, Sotto says that the Finance Secretary, or Sonny Dominguez, promised to act on his request ASAP. The entire Luzon is under community confinement or quarantine. Mass transport systems have been suspended to restricted movements of people. At kamusay po natin ang lagay sa Philippine General Hospital. Makakausap po natin ngayon sa linya ng telepono si PGH spokesperson Dr. Jonas Del Rosario. Magandang umaga po, Dr. Jonas.
Magandang umaga rin, Ed, at sa iyong mga tagapakinig.
Opo. Kamusta po tayo dyan ngayon sa PGH?
Well, okay pa naman. Siyempre, nag-set up kami ng aming team para sa paghahanda sa COVID-19. We also made adjustments sa aming workforce. No? Ang hospital ay gumagana under skeleton workforce na hindi lahat ng doktor sabay-sabay pumupunta sa hospital para mahati. We are forming teams para may karelyebo at hindi lahat ma-expose potentially dahil kung ma-expose, minsan kailangan mo mag-self-monitoring or quarantine. Meron na kaming sinet-up na COVID triage area na kung saan yung mga kababayan natin na pupunta sa PGH na lalo na yung may simptomas ng ubo, sipon, lagnat, meron na po kaming dinesignate na area para mabilis na matugunan kung sila ba ay talagang may suspetsya na may COVID-19 or hindi naman. At hiniwalay din natin ng mga kababayan natin na pumupunta sa PGH sa ibang rason, no? Dahil may mga iba pa rin siyempre emergency na. So far po, may isa lang pong pasyente na positive sa PGH, COVID-19 positive. Siya po ay na-admit noong March 11. Nasa ospital pa po at nagpapagaling. Wala naman po sa ating healthcare workers na nahawa dahil tama naman po yung proseso na sinusunod namin, yung paglalagay ng personal protective equipment, para hindi po mahawa yung ating mga doctor, nurses at iba pang paramedical staff.
Kamusta po yung how is the supply of equipment for your personnel, for example, yung PPEs?
Oo, constantly we're still asking for donations in kind. Alam mo, hindi natin alam kung gaano katagal itong ating susulungin na laban, ano? Pero maganda naman po ang natanggap naming response sa mga donors, ating mga kababayan. Marami pong nag-pledge at may mga nagpadala na po. May mga hinihintay din po kaming supply na manggagaling sa DOH. Meron na pong pinadala yung Red Cross. So, dumadating po. Pero just like what we said, talagang nangangailangan pa rin po kami, lalo na po na nagkakahirapan sa supply dahil for some reason, nauubusan na rin po yung mga suppliers. Siguro dahil sa kabila ang demand, hindi ba? So, yun po ngayon ang situation. So, but rest assured na bibigyan naman po ng mas yung mga health workers, lalo na po yung nasa frontline.
Pero Doc, at least for the benefit of our viewers, if they want to donate or to help out, what can they send to hospitals like PGH?
Opo, ang pinakamaganda po, effective, yung mismo na pong produkto. Yun na pong, ano po ba yung pag sinabing personal protective equipment? Yun po ay yung nilalagay sa ulo, yung cap, yung pong mask, dalawang klase po yan, yung surgical mask, meron din po yung N95, meron po rin yung protective shield sa muka, sa mata, either goggles or yung parang visor. Napakalaki rin po tulong, kasama po siyempre yung gown na ginagamit at yung pong gloves at yung nilalagay po na pambalot ng sapatos, yung booties, no? So kung meron po silang access sa mga ganon, malaking tulong po na madala yung mga produkto na yon. I'm sure hindi lang po PGH ang nangangailangan. kung hindi kayo malayang makakapunta sa PGH, marami pong mga ospital sa paligid nyo na maaaring nangangailangan para po sa mga frontliners natin.
Mhm. Pero po, well, of course, importante po yan. Pero I was also wondering about yung personal needs ng mga taga-PGH. Kasi we're assuming na maraming mga doktor at nurse na hindi na makalabas, at least for a week or so.
Opo,
For example,
ito po.
they need food or, or
Tama
goodies.
po. Maganda rin po yung na-bring up nyo. Nakakatuwa po na yung mga iba po nating kababayan, they are actually bringing food to our healthcare workers, yung mga nagtatrabaho po. So every day po, we receive food donations. Maraming salamat po. So well-fed po ang mga doktor, mga nurses, mga
That's
sa
good to hear.
hospital po. Pasama po doon yung mga water. Ang isa pong issue, syempre, we're trying to make arrangements. Ay sabi nyo nga, marami po sa ating magiging mga kasama sa ospital ay hindi na pwedeng pabalik-balik mula Manila. Kasi po marami po kaming mga trabahan, mga kasama na nakatira outside Metro Manila. So masyado po talagang hassle yung they have to go through the checkpoint, ganyan, dami pong nauubos na oras, ganyan, at marami rin pong chance or is na ma-expose sila. So we're looking for places where they can stay, no? So meron din po mga nag-o-offer ng transportation para dalhin sila. Ang isa pong nakita namin, marami po kaming empleyado from Cavite. So maybe kung may nakikinig from Cavite, sana po mapadali yung mga workers po ng ospital from Cavite, sana may way para madala sila near PGH kung magkaroon ng arrangement kasi I think maraming mga checkpoint from sa mga areas na yan.
Let's look at today's, at least this morning's example. Yung mga kasamahan po ninyo who had to travel through these border checkpoints, were they provided by the LGUs, some sort of a shuttle service, or lakad-lakad na lang?
Meron pong spotty po, meron pong iba. Actually, nagkaroon po ng mostly mga private groups na tumutulong. May mga ilan pa rin po kaming naglakad-lakad in between kasi po minsan wala pong masakyan. But now I can see that there are more groups. I know the Office of the Vice President has devised a way or a scheme na parang dadaanan yung mga nagtatrabaho sa ospital. May mga routes po ngayon. So sa amin po ngayon, as we speak, we actually are telling our healthcare workers, meron na rin po na-form yung PGH at to supplement po yung mga nag-o-offer sa iba. So I think maayos din ito in 2 to 3 days time kasi medyo biglaan na nangyari.
Kayo, Doc, paano kayo, well, siguro may kotse kayo.
ako may kotse, so hininto ako a couple of times, pinakita ko yung ID ko, pinalusot naman.
Well, since you've been traveling naman siguro at night or during the daytime, when you notice the checkpoints and the border crossings, for example, is there anything that you notice that we could improve on in terms of hygiene, health, and non-transmission of the disease?
Kailangan to rin pong bilisan sana yung proseso ng sa checkpoint para hindi po naiipon kasi yung social distancing minsan na hindi natin ma-implement maayos. Yun po ang nakikita ko. Tapos sana, I don't know kung parang meron sanang fast lane na for healthcare workers, parang iba. Para lang mabilis.
That's a good idea. That's actually
sana
a good idea.
Kumbaga parang meron ka special lane para lang, di ba? Kasi para lang mas mabilis, no? I can understand that they want to be very sure na totoo itong mga taong lumulusot nito. But maybe kung mapansin nila na gano'n naman, yung mga tao naman, I think yung mga tao hindi naman talaga into going to the hospitals. They don't really go out anymore, especially talagang may directive
Well,
naman.
Doc, to be honest about it, nobody likes to go to the hospital unless it's really necessary.
Kaya nga. So baka parang sana may fast lane. May fast lane. At kung makita nila sana na may mga shuttle service na parang kung pwede siguro may para nakapaskel na kumbaga healthcare workers, parang shuttle, parang medyo mabilis na lang yon, parang isa-isahin yung mga ID kung pwede.
Yeah. Baka we could have that system ipaskill sa windshield pag healthcare workers yung sakay, especially pag may shuttle ng healthcare workers.
Actually, ang instruction naman namin sa mga shuttle services na yon, ang isasakay mo lang naman ay yung mga empleyado ng ospital eh. So parang sila mismo na screen na nila yung empleyado. Oh, I'm sure also yung mga kababayan natin who wants to be with the healthcare workers who they probably think at this time ay mga na-expose na rin, no? Para kaming mga walking PUM actually, persons under monitoring kasi we have been exposed, no? So in some ways, we're really trying to distance ourselves from the rest of the population.
Anyway, Doc, we'll try to bring that up later when we talk to some government officials, the possibility of having a fast or express lane for emergency and health workers. Well, hindi lang health workers, also emergency workers, police,
Yes. Try
so on the line.
yung sana try to make sure that yung mga LGUs are coordinated na para talagang from their own area magawa nila ng paraan na malikom nila yung mga tao na nagtatrabaho sa mga ospital at madala nila sa mga pick-up points. Parang nangyayari, parang lumipat kasi yung ibang mga tao. So basta at least mapadali.
Yeah. Anyway, mas madali naman siguro mag-shuttle ngayon dahil walang masyadong traffic maliban doon sa mga checkpoint.
Oo nga. Ang sarap nga bumiyahe sa Manila para ang luwag.
Oh, sa EDSA rin. Masarap din sa EDSA. Pero tap-tapin niyo po kayo. Doc, sorry, one more question. I'm not exactly sure kasi if the PGH has test kits kasi yung test kits ata is nasa RITM eh. Pero
Okay.
do you have any word on that? I mean, does PGH have test kits and are you testing people or is it exclusively
Alright.
RITM?
I'm sure you were aware na merong UP-NIH test kit,
Opo,
right?
yung sa UP.
A lot of people are asking, and they were asking PGH, they thought that we actually have these kits commercially available to the public. Ang sagot po ay hindi. Actually po, itong test kits na to, bina-validate po. It's undergoing field validation.
Field testing, yes, sir.
Hopefully, after about 500 kits yata na na-validate, and it turns out that this kit is reliable, accurate, parang commensurate to the standards of WHO. I heard the Department of Health Secretary saying at least 95% accurate.
Opo.
Then now it's going to be used, rolled out to some of the hospitals already. Actually, the sooner we can get this available commercially, then we will be able to test more people. So we will have an idea really how many COVID positive patients do we have. Kasi ang limitation right now, ang bottleneck, limited ang testing kit.
Opo. And actually po, I think there's also a misunderstanding and a misconception na yung test kits ng COVID-19 parang pregnancy test kit na nagagawa mo sa bahay. Hindi naman po ganoon. Kailangan mo ng
Thank you for bringing that up.
Kailangan mo ng PCR machine.
Hindi yun point of care test na akala nila parang kukuhanan ka ng dugo or meron ka ng tapos positive or negative na. Hindi po ganun kabilis.
Hindi po pregnancy kit yan.
May turnaround time. Yun pong papadalang unang-una yung collection mismo, hindi basta-basta parang may kukuha sa swab yung ilong, yung lalamunan. Tapos po yun ay ilalagay sa tamang specimen collection bottle or tapos i-repack, ipapasok po yun, idadalhin po yun sa RITM. Tapos po ipapasok yun sa tinatawag na and it will take some time, no? And so ang turnaround time po usually is about 48 hours. So, yeah, hindi po parang, kasi marami nagtatanong, ba't ang tagal-tagal malaman ng result, no? So, hindi po kasi to point of care test na parang pag binigay mo, alam mo na kaagad.
Okay, Doc, maraming salamat po. Huling hirit lang po, is there anything any message you'd like to give to the public as a health practitioner, as somebody who's in the front line of this fight against COVID-19? Is there any message that you want to deliver?
Stay at home po. The doctors, the healthcare workers are in the hospital. So we're doing our job. We're manning the front line. You do your job po. You stay at home and practice social distancing.
Ayun po. Practice social distancing. Maraming salamat po, Dr. Del Rosario from PGH. Thank you for what you're doing. CNN Philippines has temporarily gone off the air. In a statement, the media network says that it is suspending broadcast for at least 24 hours. It has received word that one person in the building where its office is located has tested positive for the SARS-like disease. But to be clear, the infected person is one of the many tenants in the building and is not from CNN Philippines. The temporary suspension of broadcast is just a precautionary measure. Building officials will now disinfect the building, and CNN hopes to be back on the air sometime tomorrow.
by isang pasyente po na nagpositibo doon sa building ng CNN Philippines. Yan po ay sa Worldwide Corporate Center sa Shaw Boulevard. Again, yung empleyado po na yan ay mula sa isa pang opisina. Nasa ibang floor din nga po sila, pero nasa loob ng Worldwide Corporate Center kung nasaan ang opisina mismo ng CNN Philippines.
That was Ruth Cabal. You just saw Ruth Cabal, CNN anchor who was doing Facebook Live in lieu of the usual broadcast of CNN Philippines over the airwaves. Ingat po kayo dyan. Social distancing was strictly observed inside utility buses deployed by the Philippine Army to ferry frontline workers to clinics and hospitals. But they did not just limit their free ride to medical workers. 2 buses did not reach 50% of their capacity, so the AFP decided to take on board public riders along the way. Ingat lang po tayo dyan. Because of the virtually empty roads, the trip from SM Fairview to PGH took less than half an hour. The Army's free shuttle services will go on every day until a regular schedule is determined. AFP Civil Relations Chief Ernesto Torres added that 2 military buses and 4 more trucks will be used to transport health workers from Santolan to Balintawak and vice versa. Pero reminder lamang po, make sure you practice social distancing kahit meron ng shuttle services. Medyo ingat po at medyo layo-layo pa ng konti. And also practice good cafe etiquette. Good news naman po para sa ilang mga Pag-ibig Fund members, magpapatupad po ng 3-month moratorium sa lahat ng loans ang Pag-ibig Fund sa gitna ng COVID-19 epidemic. Para po magbigay ng karagdagang impormasyon tungkol po rito, nasa kabilang linya si Jack Jacinto Jr., ang Public Relations Head ng Pag-ibig. Magandang umaga po.
Good afternoon.
Yes, sir. Tell us about it, sir.
Hello, Mr. Lingdao.
Yes,
good
sir.
afternoon, Sir Ed, and good afternoon to all your viewers. I hope all of you are safe.
Yes, sir. Tell us about Pag-ibig's plans.
Hello.
Yes, sir. Sir, tell us about
yes.
Pag-ibig's plans. May 3-month moratorium on payment of all loans, gano'n ba? Is that
Tama po
across
ito.
the board?
Kahapon po, inanunsyo po ng ating butihing Secretary Eduardo Del Rosario, na magpapatupad po kami ng 3-month moratorium on all our Pag-ibig Fund loans. No? So this is now offered to all our members. Yung pong may mga housing loan, multipurpose loan, and calamity loans. All payments due from March 16
Apo.
up to June 15, 2020 can be applied for under a moratorium. Opo. Ang purpose po nito ay para po, Sir Ed, makapag-focus po ang ating mga kababayan, ang ating mga Pag-ibig Fund members sa pangangalaga ng kanilang mga sarili at ng kanilang mga pamilya.
Opo.
Opo.
Mr. Jack, so what we're talking about here is moving the deadlines of the payment by 3 months. Hindi naman ibig sabihin na by the 4th month you'll pay all 4, 3+1, all 4 months. Hindi naman ganon.
Tama po kayo. Tama po yan, Sir Ed. No? Yung due date nyo na, for example, ay today. Ang due date po niyan would be moved to June 18. So, i-move po natin ang mga due dates na yan. So, in short, hindi po kailangang bayaran for the next 3 months as long as they apply for it. Ano? Gumagawa po kami, Sir Ed, ngayon ng online filing facility.
Ay,
Para
teka,
po habang
Mr. Jack,
nasa
Mr. Jack, para po
hindi
klaro.
pa po pinapapasok sa aming mga tanggapan ng aming mga empleyado,
Opo.
maaari na po makapag-apply for moratorium ang ating Pag-ibig Fund members.
Okay, Mr. Jack, para po klaro, they have to apply. It does not
They
happen
have to
automatically.
Yes, they have to apply po. Opo,
Okay,
they have
okay.
to
Para
apply.
po klaro, kailangan niyo po mag-apply. Huwag niyong iintayin lang na may mangyayari. Kailangan kayo mag-apply. So you do this online?
They can do it online at magkantabay lamang po sa aming anunsyo. Ito po, nagtatrabaho po ang mga inyong lingkod Pag-ibig para po ito'y mai-up agad natin at maibigay sa ating mga miyembro.
Okay,
Ito
so-
pong online filing for moratorium of loans. Opo.
Okay po. So it is not yet available. I mean, yung online application is not yet available. We will just have to wait na lang for the advice kung
Yes,
meron ng
please.
website.
And
Kung saan
hopefully, Sir Ed, we can again go on air through your program so we can
Yes, sir.
advise our members accordingly po.
Yes, sir. That's good to know, sir. Okay, sir. Just to be clear again, people have to apply for the moratorium. It will not happen automatically. So wag po kayong magrereklamo pagkatapos ng 3 months na bakit dumagdag.
Please, opo.
Pag hindi ka
Please,
nag-apply.
opo.
Okay po. Paano po yung ayuda dun sa mga mga affected members? Is there any sort of relief?
Ito naman po, we're thinking of the best possible way to accept calamity loan applications. Again po, suspended po kasi ang work natin ngayon. So wala pong makakatanggap ng mga calamity loan applications
Opo.
ng ating mga members. But our CEO yesterday did also announce that we have drop boxes May mga drop box po tayo sa ating mga branches in NCR, Luzon, and even in Visayas and Mindanao, where members can drop their loan applications, cash loan ho ito, cash loan applications, so that we can process. Pipick upin ho natin yan, ipaprocess, at yung cash proceeds, yung pong loan nila, ay matatanggap na lamang po nila through their respective cash cards.
Okay. Okay, maraming salamat po, Mr. Jack Jacinto, ang spokesperson po ng Pag-ibig. We hope to hear from you again as soon as you already have available the online applications for the
Yes,
moratorium.
sir, Ed. Yes, sir, Ed, and thank you again for the chance, sir,
Maraming
to
salamat po.
inform our members.
Ingat po
Thank
tayo
you.
dyan. At para po makaingin ng update tungkol sa sitwasyon sa Southern Luzon, makakausap po natin ngayon ng News 5 correspondent na si Del De Vera, live po mula sa General Tria sa Gentry Highway sa may Kawit, Cavite. Del, andyan ka na ba? Del, go ahead.
Ed, sa ngayon nga ay nakalagay doon sa magkabilang side ng boundary ng Kawit at Bacoor na naka-total lockdown itong dalawang syudad o munisipyo ng Cavite, parehas ang Kawit at Bacoor. Kanina may mga dumadaan dito sa likuran natin, papasok ng Bacoor, pero merong hindi pinapasok. Ang tanging pinapapasok lang nila ay may dalang mga tubig, may mga dalang basic necessities and goods gaya ng tubig at yung mga bigas. Maging doon sa kabilang side, papasok ng Kawit, nakasarado na rin, bantay sarado ang PNP at maging ang barangay at health officials para hindi mapapasok. Pero kanina, noong papunta tayo dito sa banda, sa part na to ng Cavite, ay dumaan din tayo sa boundary ng Las Piñas at Bacoor, Cavite, doon sa pagkatapos ng Coastal Road at sa may bandang Zapote Road, kung saan nagkaroon ng konting build-up doon sa papasok ng Las Piñas dahil nga isa-isang chinecheck yung ID at saka yung mga sakay na makapapasok ng Las Piñas. Tapos yun namang papasok ng Bacoor ay may nakaharang na fire truck para hindi makapasok yung mga motorista. Ed?
Del, medyo gumilid ka ng konti para makita natin yung checkpoint. Yung nasa likod mo, bale, iyan yung border ng Kawit o yung border ng Kawit yung nasa harapan mo?
At ito nasa likuran natin ay ito yung papasok ng Bacoor, Cavite.
Bacoor,
Doon naman
okay.
sa harapan natin, ito yung papasok ng Kawit, Cavite. Kung makikita nyo, nandiyan yung mga barangay health workers at saka barangay officials na nakabantay at lumalapit na rin agad para i-check yung mga ID ng mga motorista kung talagang residente sila ng Bacoor para papasukin o kaya itaboy palabas ng Bacoor.
Okay. Well, Dale, it's a good thing that they have a checkpoint, pero mapapansin mo rin sa checkpoint nila, marami sa kanila walang PPE, walang personal equipment PPE, personal protective equipment. May ibang naka-mask, pero karamihan o halos lahat walang guantes at may iba sa kanila nga walang masks eh.
Tama ka dyan, Ed. Wala nga silang mga PPE na ginagamit. Tanging mask lang yung kanilang protection sakaling may mga dumaan na PUI or PUM dito sa kanilang mga binabantayang boundary. Maya-maya ititingnan natin at aalamin natin kung bakit hanggang ngayon ay wala pa rin silang PPE na ginagamit. Although makikita natin naman dito sa lugar na kinatatayuan natin ay medyo mainit. Medyo nakabilad din sila sa ilalim ng araw.
Okay. Dil, ngayon ikaw tsaka yung tropa mo, mga 2-3 araw na kayo nasa labas eh. How's it going if you compare actually this is technically day 2, but if you look at it, parang day 3 na yan eh. Day 2 ng quarantine, are they improving on the systems? Are there less people on the road? Give us your general assessment based on your observations in the last 3 days.
Yung observation natin within Metro Manila is talaga namang nawala or sobrang nag-decrease yung volume ng tao doon sa mga kalsada. Pero kasi dito sa bandang Cavite, nung mga dinadaanan natin, may mga tao pa rin tayo nakikita sa kalsada. Unlike doon sa Metro Manila na, mako-compare natin na medyo mas nakikinig ngayon yung mga nasa Metro Manila. Kasi dito may makikita ka nakabike or nakatambay sa kalsada or nakasakay sa motor, umiikot-ikot din. Ed?
Dale, kayo naman, kamusta? Huling hirit na lang ha. Kamusta kayong yung tropa nating mga nagko-cover diyan sa labas? How are you doing? What do you do to protect yourselves from infection? And so down the line. For example, from what I understand, yung mga tropa natin ngayon hindi na bumabalik ng opisina. So medyo meron tayong self-quarantine na sarili natin. Tell us about your procedures.
Yung sa amin naman, Ed, meron kaming dala laging disinfectant para ma-disinfect yung mga gamit natin sa camera, pati sa sakyan. Pero meron din yung provided tayong mask and alcohol para, kumbaga, malinis, magkaroon din tayo ng protection sa sarili. Sa ngayon, hindi na rin kami masyadong lumalapit sa mga tao. Iniiwasan na rin yung interviews unless kailangan. May mga time na nagfo-phone patch interviews na lang tayo just to get the information that we need. Pero ngayon, yun nga, nabanggit mo rin kanina, iniiwasan na rin pumasok sa loob ng newsroom dahil para ma-contain na rin yung sakaling mag-infected or natamaan or nagkaroon ng symptoms ng COVID-19.
Pero actually, ang talagang gusto kong tanongin, hindi ko matanong saan kayo kumakain? lalo na ikaw. Saan kayo kumakain? Yung tropa natin.
And pagdating naman sa pagkain, may provided naman na food packs itong office para, kumbaga, if ever magkaroon na tayo ng magutom, may makakain. Pero along the way, may mga drive-thru na na-orderan naman kami or na nakakabili naman kami ng mga pagkain sa mga fast food chain.
Okay, Dale, maraming salamat at ingat kayo sa parating nagpo-fast food. So ingat tayo. Thank you very much. Dale Rivera reporting live from Cavite. The Transport Department is also deploying buses to ferry frontline health workers as the country struggles to contain the spread of COVID-19. Starting 7 a.m. today, 10 buses were initially deployed at the Parañaque Integrated Terminal Exchange or PTEX and at the BFCT East Metro Transport Terminal in Marikina. The first route starts at PTEX when it will travel to Quezon City General Hospital. Along the way, the bus will stop at the Makati Medical Center, St. Luke's, BGC, Rizal Medical Center in Pasig, the Medical City in Ortigas, East Avenue Medical Center, Philippine Heart Center, and Lung Center in Quezon City. Very important po ito dun sa mga bumabiyahe ng mga health workers natin. So we'll keep on repeating this as we go along the day. There will be also trips to Manila. The ride will start at PTEX and will travel via Taft Avenue. It will stop at Pasay City General Hospital, Adventist Medical Center, PGH, Jose Reyes Memorial Medical Center, Manila Doctors Hospital, UST Hospital, San Lazaro Hospital, before terminating at the Chinese General Hospital. Generally po, ito ay for health workers lamang, pero kagaya ng report namin kanina, yung Army kanina, napansin nila kalahati lamang ng busang napupuno, so nagsakay na sila ng ibang tao. Pero ingat pa rin po tayo dyan. Meanwhile, the last trip will start at BFCT to San Lazaro Hospital. It will also pass through the Quirino Memorial Medical Center, the East Avenue Medical Center, Philippine Heart Center, Lung Center, Providence Hospital, Capital Medical Center, St. Luke's, Quezon City, and UST Hospital in España. A new study finds that the highly contagious coronavirus can survive for hours in the air and for days on some surfaces. Researchers from the U.S. National Institute of Allergy and Infectious Diseases mimic the movement of the virus when expelled through a cough or a sneeze. Results show that air droplets carrying the virus can still infect people for at least 3 hours. On plastic and stainless steel, the virus remains viable after 3 days. The shortest survival time recorded was on cardboard at 24 hours and on copper at just 4 hours. Again po, this is only a study pa lang. There is no word yet from the WHO on the veracity of the study. The World Bank Group is boosting its response time to the SARS-CoV-2 pandemic to more than $14 billion or more than 700 billion pesos. This is to fast-track financing for affected companies and to help countries fund their efforts in preventing and detecting and responding to the rapid spread of COVID-19. The WB's sister organization, the International Finance Center, or the IFC, will pitch in $8 billion of the total amount. This will go to financial institutions so they can continue offering loans to private companies affected by the coronavirus disease. The Interagency Task Force tweaked the guidelines on international flights. Now, overseas workers, balikbayans, and foreigners may fly out of the Philippines to any hub in Luzon anytime in the month-long quarantine period. But they should only travel to airports within 24 hours of the date and time of departure. They should also bring with them supporting documents such as tickets, boarding passes, or flight itineraries to show to authorities manning the checkpoints. They will be allowed to travel to airports in a private car. They may be accompanied by one person, again, just one person, and I repeat, one person. The companion should also hold a copy of the passenger's ticket or his itinerary. OWA will provide transport services for returning overseas workers from international ports to their destination. Earlier, the government barred all international flights starting March 20, 2020. The task force also created exemptions for certain hotels. This covers hotels who currently have foreign guests and other tenants with existing long-term leases. The exemption also covers accommodations for employees offering essential services. But the task force clarifies that no new booking accommodations, and we repeat, no new booking accommodations shall be permitted by these establishments. Wala pong bagong kliyenteng pwedeng mag-book. Operations will also be limited to providing basic lodging to guests. At kuha rin po tayo ng updates mula sa isa sa mga ospital na tumututok sa mga pasyenteng may COVID-19 sa Medical City sa Pasig. Nasa linya po ng telepono si Dr. Carl Henson, Epidemic Rapid Response Team Head po ng Medical City. Magandang hapon po.
Hi, magandang hapon po.
Yes, sir. Doctor, thank you for joining us. Pa-update po muna doon sa 23 confirmed patients ng Medical City.
Well, yung number po sa amin na 23, yung iba po dyan, coordinated po with RESU, and they have been sent to other institutions or have been asked po na mag-home quarantine na lang, lalo na po yung mga mild symptoms. Right now po, meron po kaming 16 na confirmed cases sa Medical City na naka-admit. Hindi po yun lahat nag-test sa Medical City. So medyo halo-halo po yung numbers, no? Dalawa po ang nasa ICU and 14 po ang nasa floors. Regular units po. Pero meron din po kaming mga PUIs na inaantay po namin yung results. 8 po doon nasa ICU and 41 yung nasa floor. So, yung nakapublish po sa DOH na nakalista ang pangalan namin at kung saan yung mga pasyente, hindi automatic na nasa amin yung mga pasyente na yon. Yung iba, nasa ibang...
Okay. So they're not necessarily physically there with you. They may have been devolved to other institutions.
Yes po, or at home.
Opo. Ay, Doc, just to be clear, when you say at home, you're referring to persons under investigation or people who are positive?
Opo. So, right now po, and this is, I think, important for the public to know, right now po, for patients po na with very mild symptoms, bata, walang medical problems, tapos mild ang symptoms, they can actually stay home for quarantine. Hindi po lahat ina-admit sa ospital, kahit confirmed case po.
Oh, okay. Well, it's good that we heard this from you kasi we always assume that all the positive or all the COVID-19 positive patients have to be confined in a strict negative pressure room.
Actually po, kasi alam po natin na kulang po ang kits natin sa RITM na.
Opo.
And the directive actually now to hospitals is for PUIs na mild lang po ang symptoms, wala pong medical problems, otherwise stable, at bata, ibig sabihin siguro mga less than 50, pinapauwi po natin ito for home quarantine. So definitely po, doon sa some of those PUIs actually are sick with COVID, pero because they are mildly symptomatic, pwede na sila sa bahay. Basta naka-home quarantine, ibig sabihin, naka-isolate sila from the rest of their family, etc. No? So ngayon po, ang mga hospitals are directed by the DOH na admitin lang po yung moderately symptomatic tsaka yung very hingal, tapos yung critically ill at yung may mga medical problems, no? Mga may diabetes, may cancer na possibly PUIs, kailangan po yan na o-observe sa ospital.
Doc, I'll have to ask you to repeat that part again. Ang directive ng DOH is for the hospitals to
Yung
only
ginagamit
admit...
po natin na algorithm po ngayon, no? Lahat po ng mildly symptomatic, yung ubo lang, konting sipon, konting sore throat, otherwise stable po, young, yung less than 50 years old siguro ang magandang cutoff. Tapos walang masyadong medical problems. Pwede po sila sa bahay magstay. In fact po sa ER po namin, yung mga ganitong profile ng pasyente, without testing them, we will send them home. So definitely, some of them might be positive for COVID, pero dahil hindi sila masyadong may sakit, pwede po silang magstay sa bahay.
But Doc, I'm sorry, just a layman's question. Of course, I'm not a doctor, I'm not a medical practitioner. Is there any danger here of spreading the disease, even if they're mildly symptomatic and they are
Definitely
stable?
po meron. Definitely po meron. That's why the instruction po is kung nasa bahay and we put them on home quarantine, hindi sila magkakasosyo ng mga kasama nila sa bahay. Ideally, kung yung bahay has a separate room, dapat naka-separate yung pasyente in a separate room. I understand that this would be very difficult for some of our kababayans na living in a, an open area. Pero meron pong recommendations actually ang WHO para po magawa ng paraan yung mga ganong type of settings, no? Nakahiwalay sila, maghuhugas palagi ng kamay. If nasa open room, siguro dapat mag-mask sa loob ng bahay, etc. May mga recommendations po ang WHO for that.
As far as the medical city po is concerned, ilan po yung mga positive na confined sa bahay na lang?
I do not have the exact number, pero I would say siguro mga 5 to 6.
5 to 6?
Estimate po yun. Opo, estimate po.
And these are mostly, again, with the criteria you pointed out, these are mostly young with no medical symptoms. They are mildly symptomatic.
Apo.
And they have no conditions.
Yes po. But let me take this opportunity rin, sir, to bring up kasi some of our confirmed patients na dapat pwede sa bahay, ang balita po sa amin, nadi-discriminate po sila sa barangay. No, mismong barangay officials po ang nagpapaalis sa kanila sa kanilang mga bahay, even if pwede silang mag-home quarantine. I have brought this up po with some people in the DOH. Pero I think as a community, as a nation, we really should be very understanding of these patients and not discriminate. If po we observe yung ating mga rules on hand hygiene, social distancing, washing hands frequently, and cough etiquette, I think we should be able to take care of these mildly symptomatic patients sa bahay and not discriminate kasi hindi naman po nila sinasadya na meron silang sakit.
Of course po. It is not their fault that they're victims. Pero po, Doc, of course, I also try to understand the problem of people in the barangays who are concerned for the community. Perhaps from their point of view, it's the health of one vis-a-vis the health of all. So with that po in mind, what precautions are being taken to make sure that hindi po ito kumalat? Kasi baka naman just one mistake can lead to a bigger problem. Are these people who've been sent home, even though they are positive, are they being closely monitored by health officials or not? Kasi kung pababayaan po natin sa pamilya, baka mamaya magkamali sila o alam po, hindi na sila...
Naintindihan ko po yung concern, sir. Lahat po ng PUIs na pinapauwi namin from Medical City, and I believe this is practiced in all hospitals, lahat po yan ini-endorse naman po sa DOH. We fill out the paperwork and we endorse the cases closely po to the Regional Epidemiologic Surveillance Units or yung RESU na tinatawag natin. So, our DOH po has a record of the cases that we send home. Understandably, syempre, we expect that DOH is also at this time very busy and undermanned. Pero the mandate po to make sure po that the the patients at home are, doing well, ganyan, ini-endorse po natin sila sa RESU po.
Doc, cambio ko, kamusta po yung recovery rate natin? How many have recovered already from your hospital?
So, yesterday po, we sent home one patient from the medical city. I am aware po that some of the patients na napauwi, yung meron number na running ang DOH about cured or recovered cases, ito po ay may mga negative swabs, no? Pero dahil nga po we are also short on kits, the new recommendation then that we are following is basta umigi na yung pakiramdam ng pasyente, magaling na siya yung pakiramdam niya, pwede na siyang pauwiin nang hindi po inuulit yung test. No? That's also a new algorithm. So, yun pong pinauwi namin kahapon, inaantay pa po namin yung repeat swab niya, pero baka po magpauwi rin kami ng maybe 2, maybe 3 today, depending po on how they continue to improve and depende sa kanilang mga attending physicians. So, gumagaling naman po. And most of our cases, as I have already said, so no, we have 16 confirmed. 2 lang po ang nasa ICU, 14 ang nasa floor. So, yung nasa regular units, stable naman po sila.
Okay, Doc, let me ask naman about your personnel. How are they coping? Are they okay? Do they have enough equipment, PPEs?
Ang personnel po namin, medyo short po kami ngayon. In the initial part of the outbreak, no, when hindi pa tayo masyadong highly suspicious of COVID, lalo na yung mga atypical na presentations, meron pong mga nakalusot sa floors na parang iba ang presentation tapos turned out COVID pala. So ito po yung talagang naging issue sa hospital namin. That's why we had to put some healthcare workers on home quarantine. Now po, that has been minimized and everyone is now protected. No? So that problem has been resolved. Pero at this time, we have about 170 pa rin na healthcare workers, halo-halo po yan, doctors, nurses, medtechs, etc., who are still on home quarantine, either because they were exposed in the hospital or they were exposed in the community. Pero dahil sila ay haharap sa pasyente, we are being very careful po about letting them in back to work.
But
Ngayon, for
Doc,
PPEs po,
sige po.
Opo, so you asked about PPEs, we are also short, no? Siguro iniisip ng iba, Medical City is a big hospital, pero ang katotohanan is there's a worldwide shortage and we are finding it very difficult to source out yung aming mga supplies, masks, N95, gowns, etc. No? One thing that I would like to bring up and I think needs the attention also of our government is meron pong mga suppliers so we are finding it very difficult to look for supplies and the supplies are more expensive than usual.
I'm sorry, sir, they're more expensive than usual.
Yes po.
By how much po? 50%? 100%?
May iba po mga 4 times the usual.
400%? What kind of supplies are we talking about? Masks or surgical?
In general, sir. Masks in general. So surgical masks and N95. But so we are very grateful for those who have donated masks to us. We have started using them and we welcome donations. But the hospital is working very hard to make sure that we are able to buy enough PPEs so that our staff are protected.
Doc, kamusta po yung biyahe ng mga tauhan ninyo na walang sasakyan? Did they have any problems today?
Kahapon po, very difficult for them. Lalo na po, so nasa Ortigas Avenue po kami.
Opo.
And marami po of our healthcare workers live in Region 4, in Cainta and that area po.
Yeah,
no?
eastern.
To the east. And yesterday, yung first bus, kasi we set up a bus that has pick-up points. No? Yung isa coming from Tikling, left Tikling at 6 o'clock in the morning, dating dito sa amin 11 o'clock na or past 11 because of 2 choke points. But because of the help po of the Cainta local government, no? Mayor Nieto, and we are very grateful for him, kaya po medyo napabilis. And today po, wala na pong naging problema po doon sa pagpunta po nila dito as far as I know. Wala na pong na-report sa akin.
Doc, huling hirit na lang. Of course, those who can donate PPEs, they should. Pero syempre, hindi naman ganun karaming ordinaryong Pilipinang may PPEs. Pero baka mayroon pa kayo ibang kailangan dyan na hindi related sa medical profession. For example, sabihin natin, pagkain.
We have been very blessed po that there has been a movement among our consultants and some outside companies po who have been donating food. So in terms of food and water and I think our staff are well provided. Yun po, ang number one need po talaga, and I think this is this is something that all hospitals are experiencing po, is
Apo.
protection for our healthcare workers in the form of masks and gowns and face shields and kasi our capacity to take care of patients is only as good as our capacity to protect our healthcare workers. Kapag hindi po
Precise po.
protektado yung healthcare workers, hindi po kami makaka-take care of patients.
Okay, good point, sir. Dr. Carl Henson, maraming salamat po for joining us. Dr. Carl Henson is from the Medical City. Nanawagan naman po ang Philippine Association of Meat Processors na iwasang mag-panic buying ng karne. Ito'y matapos sa halos mag-triple ang demand sa processed meat at canned goods ngayong pinapatupad ng Enhanced Community Quarantine. Para mas mapag-usapan yan, makausap po natin live si Shaila Francisco na nasa Quezon City. Shaila, exactly asan ka sa Quezon City?
Ed, nandito ako sa Department of Agriculture sa Quezon City, pero kaugnay doon sa sinasabi mo, hindi na lang mga DTI or government agencies yung nagsasabing huwag mag-panic buying, kundi pati yung private sector, yung Philippine Association of Meat Processors Incorporated. Ito'y matapos tumbriple yung demand para sa mga canned meat products at sa mga processed meat. Doon sa supermarket sa Quezon City na pinuntahan natin kanina, halimbawa, kahit kokonti yung mga customer na bumibili, malalaki or mararami yung mga binibili nilang mga canned meat products. Ang sabi sa atin ng PAMPI, nasa 4 to 6 weeks yung supply. Pero yung doon sa mga supply sa supermarkets, mabilis na nababawasan at mabilis na apektuhan dahil doon sa pinapatupad nga na Enhanced Community Quarantine kung saan natatakot yung iba maraming bumibili. Ayon sa PAMPI, kaya naman mag-deliver ng mga suppliers. Ang problema, nililimitahan na rin nila yung binibigay sa mga retailers at minamanage nila yung excessive orders. Bagamat kaya rin makapag-produce ng mga planta ng mas maraming supply, ang problema, yung mga raw materials, yung mga packaging kunwari ng mga kanilang products, yung mga lalagyanan, pati na rin yung mga diesel at yung mga coal na ginagamit sa manufacturing plants ay hinaharangan minsan pa rin sa checkpoints. Ngayon nakikiusap ang PAMPI kung kaya ng mga supermarkets na limitahan yung mga purchases ng mga customers. Ngayon, Ed, kaya tayo nandito sa Quezon City sa Department of Agriculture kasi tuloy-tuloy yung pagpaproseso ng food lane pass para sa mga dealers. Sa 200 na yung food dealers na nag-apply at nakakuha ng mga food lane pass, ito yung gagamitin para mas mabilis yung pagbabiyahe nila ng mga produkto. Ayon sa PNP kanina nung sa briefing na ginawa nila, sinabi nila na may nakatakda na or may nilaan na ang special lane sa NLEX at sa SLEX para doon sa mga agriculture products. Pero sa kabila nito, nakausap natin yung mga agri-groups, nakakaranas pa rin sila ng mga ibang problema. Ed?
Okay. Shaila, yung sinabi mo kanina, meron pa tayong 4 to 6 weeks worth of canned goods. Did I hear you right there? 4 to 6 weeks?
Oo, tama yan, no? Yung 4 to 6 weeks, hindi lang yan nakalagay dun sa mga supermarkets. Yung iba dyan nakalagay dun sa mga warehouses, yung iba nakalagay dun sa mga planta. So, sapat na sapat yan. Pero ang nagiging problema kasi, pag unusual demand, mabilis na withdraw ng mga supermarkets yung mga stocks nila sa warehouse. So, kailangan nila ng mas madalas, kunwari, na delivery. Doon tayo nagkakaroon ng problema, Ed.
Yeah. Well, I asked about that kasi we're only on week 1, hanggang Abril pa tong quarantine na ito. So, kung tumiple yung consumption, at least yung purchasing ng canned goods, madaling maano yung 4 to 6 weeks yan. So kailangan talaga maghigpit sila, I would think, kailangan sila maghigpit dun sa distribution. Kailangan magluwag sa distribution at maghigpit dun sa volume ng purchasing. Is there any move along those lines by government agencies that you've talked to, yung lilimitahan yung pwedeng bilhin ng mga tao?
Oo, no, wala pa tayo nakikitang ganyan. Pero sa mga LGUs, kunwari, nakita natin sa Pasig at Valenzuela, meron na silang anti-hoarding and anti-panic buying. So ilan yan sa mga mekanismo or mga tulong na pwedeng magawa ng national government. Ang hinihilig naman lang ng PAMPI, although sila, kaya naman nila mag-produce, siguro mag-participate or mag-ooperate din yung mga consumers na huwag mag-panic buying kasi naandyan naman yung supply, 4 to 6 weeks, pwedeng tumagal din yan ng 2.5 months kung usual yung demand pagbibili doon sa mga supermarkets.
Okay. Number 2 naman, may napapansin ka ba na gumagalaw ang mga presyo kasi ang taas ng demand? Although meron tayong price freeze, di ba? Meron tayong price freeze because of the zero calamity. Pero by any chance, meron bang gumagalaw na presyo dyan?
Alam mo, Ed, wala tayo nakita kanina nung pumunta tayo sa supermarket. Ang nakita natin kanina yung mga galunggong, yung mga isda, tsaka yung mga pork. Ang nangyayari kasi mas konti yung mga bumibili. Kaya hinahayaan na lang nung mga tao doon sa presyo. Although may price freeze, hindi na binabago ng mga retailers yung presyo para mabili yung mga produkto nila. Although may naririnig tayong reports, hindi pa tayo nakakapunta sa palengke, pero coming from the DA itself, na yung kalamansi tumataas, nakaapekto siguro yung mga delivery kahapon, kaya may konting paggalaw kasi medyo na-bar yung sa checkpoints yung ilang mga deliveries, Ed.
Okay, maraming salamat po, Shala Francisco. And again, to everybody there, remember that the food you hoard is food you take away from somebody else who probably cannot afford to hoard. Now, this just crossing our wires, the Health Department records 6 new cases of COVID-19 in the Philippines, bringing the total number of confirmed cases in the country to 193. South Korean group BTS, in other news, may have canceled their concert in Seoul over coronavirus fears, but the 7-member band is still making waves online thanks to fervent supporters who are fangirling from home. The group's fan base is getting their fix online through live streaming broadcasts and interacting with the idols on Korean networking sites. But the influence of BTS does not stop there. One of the group members, Suga, is that his name? Suga or Sugar? Suga siguro. Suga donated a million won in the fight against COVID. The rapper hails from Daegu, which is the hardest hit by the country's coronavirus outbreak. Remember, dito yung merong kulto. After his donation, around 11,000 BTS fans, also known as ARMY, pulled together 500 million won for relief efforts. I'm sorry, I'm not familiar with BTS. South Korea reported 93 new cases on Wednesday, bringing its total infections to around 8,300 people. And over in Madrid, more than 20 inmates climbed to the roof of a migrant detention center to protest the alleged poor conditions inside the facility, which they say was facilitating the spread of the coronavirus disease. The demonstrators said that many detainees have been showing symptoms of the virus, which means that isolation measures were insufficient. Firefighters eventually escorted the group of protesters back inside the building without any incident. Spain's 47 million residents have been under partial lockdown since Saturday. They are allowed to leave their homes only to go to work for food, buy food, or visit pharmacies and hospitals. The Spanish government reported 182 new fatalities overnight, raising the death toll to 481, making it the country with the fastest rising death toll after Italy. And if you think you're suffering from any symptom of COVID-19, please call this number, 02-894-2683. I'm sorry, 02-894-26843. Again, that's 02-894-26843 or 894 COVID for COVID. If you are a PLDT or Smart subscriber, you can also dial 1555 on your phone. Please take note of these numbers, 1555 if you are using Smart or PLDT. And that is the latest on the enhanced and expanded community quarantine in Luzon. For more updates, follow News 5, the Philippine Star, and Business World Online. I'm Ed Lingao. We are One News.